Hello, everyone. This is Shed Race from CVI 2025. I'm privileged to be with Dr. Shirling Tsai to talk about the multidisciplinary approach for patients with PAD. Dr. Tsai, thanks for being with us.
Thank you.
So, endovascular is like structural heart disease. It's involve multiple specialists. So let's talk about how you approach this problem and why the team is important.
Oh, I think so. Our PAD patients are so complex. They have coronary disease, they have complex peripheral vascular disease. It really does take a multidisciplinary approach. The cardiologists, the vascular surgeons, the interventionalists, and also there's so many ways to approach these vascular problems with multiple levels of disease, aortoiliac disease, infrainguinal disease, tibial disease. It really does. And then the wound care aspect. It is a whole team approach to all of these problems. And I think this type of meeting where you see so many different specialists is great to sort of highlight the importance of multidisciplinary approach to this PAD.
Absolutely. So when you mentioned back in the day was everybody has an own track and treat this disease in own state. So why now it's open all of a sudden and we have everybody on board?
Well, I think, first of all, I think the endovascular stuff, we as vascular surgeons do a lot of it, but there is so much to learn from other interventionalists, interventional cardiology, interventional radiology, just in terms of techniques and just different approaches and different ways to look at the problem. Because really there are just multiple solutions to this. And I don't think there's necessarily a right solution every time. A lot of it is based on the patient and then what resources you have and everything. But every time I come to this meeting, in fact, I learn something new, either a new approach or a new way to look at something, or just new little tips and tricks that I think is fascinating.
Yeah. PAD is a very pandemic in the United States, and I feel it is a pocket only treating this disease. Sometimes a pocket of cardiologists, pocket of vascular surgeon, and so forth. Do you think this is more reason for us to be collaborative and also train more people to take care of these patients?
Yes, and I think it's actually really good for the trainees who come to this meeting to see the collaborative approach to it, because it's not just the technically fixing the PAD, but also like the follow-up, the wound care that has to come after it. It becomes sort of a chronic problem for the patient. So I think it's really important to have that approach and for the trainees to see how that approach is implemented.
Okay, thank you so much, Jose, for your time and for expertise and for being on the executive committee for the endovascular disease at CVI. Watch these videos and others on CVI YouTube channel. This is Shad Race coming to you from Austin, Texas. Thanks again.